Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Acute epididymo orchitis. So what by definition is the inflammation of the testis as well as the epididymis. Now what is the common cause? The common cause will include the ascending. So ascending bacterial infection, and this is from the lower urinary tract. Next is the most common organism. It is in case of the sexually active males less than 35 years. Then there is also the chlamydia. So the treatment here is the doxycycline. So there is a common organism of in other populations, that is a E. coli. Now the clinical features is it can include fever, it can include pain in the inguinal or scrotal region. Then there can also be the burning micturition. Now what are the findings of the examination? There can be the French sign. The French sign is nothing but it is positive. Then comes the cremastic. The cremastic reflex. Cremastic reflex is also it is positive. Then comes the thickened cord. There can be thickened cord. Now what is the IOC? IOC means there is a ultrasound. It is thick enlarged cord. It's thickened enlarged cord, and this is the minimal fluid collection. Then comes the urine examination. Urine examination, you have the WBC. Then there is also the urine culture and the sensitivity which can be done. And the treatment is by antibiotics. There is also the scrotal support which can be given, as well as the NSAIDs. To learn and grow daily like this, please do subscribe.